Hi, Mark.
You can start when you're ready.
Okay, let's go ahead and start. Good morning, everyone, and welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. Today's webinar is Acupuncture for Wen Bing Diseases, Part 2 with Marc Mastrandrea. Today's webinar is being recorded and presented by Lotus Institute of Integrative Medicine. And here at eLotus, we have been hosting educational courses for over 2 decades. And we are proud to be your trusted source of premium CU content, offering classes from over 200 speakers with 600 courses and 3,000 hours of CE content. Today, we are lucky to have with us again Marc Mastrandrea. Oh, sorry, I just butchered your last name. He'll be returning to teach Wen Bing disease, and we'll also have Wen Bing disease part 3 and 4 later on this year. 3 months ago, he taught the Shanghan Lin course in November 2020, and it was a lot of great information. So he did talk about it yesterday. And if you want to access the courses, if you're a gold member, you always have free access to it. And if you are not yet a gold pass member, you can still purchase the course individually. It's about $100 for each day, and you can check that on his bio page. So Marc is a student of Jeffrey Yuen and has develop a deep understanding of the classics and is able to so elegantly apply the theories to practical approaches in the clinic. He is filled with so much knowledge and is extremely generous with it. You're going to learn a lot today, so be prepared to take notes, although his notes are already very extensive for you guys. So as I mentioned earlier before we started, the lecture notes are available for download. You can find them on the blue colored course access page. I did upload an updated version right before class started, so be sure to check on it, and you'll know that it's updated because I wrote the word updated at the end with an exclamation mark. And also there's another download, which is case studies, so make sure to download that as well, as Marc will be going over both today. So yesterday he did cover skin diagnosis, and he told me that he will cover that again today, but more in depth. So it's going to be a little bit refresher from yesterday's class towards the end. And the webinar today will be from 9 a.m. to 6 p.m. We'll have a 1-hour lunch break from 1 to 2 p.m. Pacific time. And we'll have 2 breaks in the morning and 2 in the afternoon. Marc will let you know when that is. So, and in the chat room, I see that a lot of people are really good with the chat room. You will see that there's an option that is set to all panelists. That is the default setting for the chat room. So when you send it to all panelists, the rest of your colleagues won't be able to see what you're writing. So be sure to change the setting to all panelists and attendees. That way everyone can be part of the conversation. The quiz for today's class will be available tomorrow. I'll send an email out when that is ready. And since tomorrow is Monday, that's also when the video replay will be ready for both part 1 and part 2's class. I will send an email out a separate email when that one is ready as well. All right, that's it for housekeeping, guys. Let's go ahead and welcome Marc back. His video is gone. There he is.
Can you see me now?
Yes, I can. I'm going to go ahead and stop my share, and then you can start yours.
All righty, sounds good. Hi, guys. All right, hold on. Readjust this here. Good. Let's see. Let's get this screen share for today. Oh, hold on. I gotta go like this. All right, share this. This is just the slides from yesterday that we went over. We're going to catch up on them. We're going to go over some of this stuff again. And then here we go. All right, so we're going to review. Welcome back. It's been a couple long days. And yeah, we're back into it. So yesterday we did a lot more than I thought we would. My slides are only half of what they were for Shanghan Lin, because there was so much channel explanation in Shanghan Lin that we needed to go over, and a lot of that plays into Wen Bing, right? So there's not as much. And so I feel like this course isn't necessarily on the level of when I taught for Shanghanlun. So I personally feel like I want to revise it, but I went back last night and I was up till like 1 a.m. again, after teaching yesterday, writing up case studies and also adding some things here and there to adjust the notes and adding a whole explanation on Sanjiao pattern treatment versus Wen Bing pattern treatment. It's not a lot, but it's at least something that I felt like was significantly lacking that I should have talked about more. So that's in the updated notes. And then, of course, the case studies. We've got about 6 case studies that I wrote up today. Some are ones that I had from when I went to school, and some are ones that I wrote up that I've either seen or you could take and basically put together. So, all right. Let's see here. All right. Here we are. All right. People are rolling in. Good morning, everybody. All right, so we're going to get through this. I got to kind of fast forward. We went through the history. We talked about Liu Wansu, right, and his creation of the Hanliang Pai, right, the school of cooling and cold, right, and how this generated the idea of wanting to clear heat and nourish yin, right, because that was a big problem, right, that wasn't being done. It's this idea of nourishing yin and clear. Well, first he talked about clearing heat, right, people being yang, and then eventually the idea of Judan Shi came in and the idea of cooling, nourishing yin, right. So we went through this. We talked about Li Dong Yuan, Zhang Zihe, right. So all these different people, right. There's Judan Shi. We talked about all this. We talked about the patriarchs, right. So Wu Youke came up. He was the first person to write about warm epidemics, right. So he wrote about Wen Bing, Wen Yi, right. And he wrote about this idea of Li Qi, this pestilent factor, which is what we see predominantly in Wen Bing and Wen Yi. So it's not the Liu Qi, the 6 Qi, the 6 natural Qi from the external. He also talked about this other version of Qi that would come in and cause issues. So there was that, right? Ye Tianshi, we talked about him and his development of the 4 levels, right? The Wei, Qi, Ying, and Shui, right? So this idea of the Wei, the Qi, the Ying Qi, and the Shui, the blood, right? Shui. So this is his idea, right? That he developed. And he developed treatments for it. Then Xu Zhengbai came along and he talked about dampness and how dampness is a compounding factor. Damp heat can happen, especially if the stomach turbidity is a problem, right? So he developed methods of treatment for this, where he talked about the treatment of dampness from the stomach and the spleen. Wu Zhutong finally summarized all these ideas into sort of a book or writings that detailed analysis, right? The Wen Bing Qiao Bian, right? This idea of you have the 4 levels, right? But you also have this idea of the Sanjiao mechanism, this pathway of the Sanjiao that you can see this heat pathology come through that, right? And affect the Sanjiao and the organs, the Zangfu, and via the channels as it passes through. So this is something that Wu Zhutong talked about. I need a lot more water today because I've been up late 2 nights. And so he synthesized the idea of these 2 methods over each other, and then the idea of treatment, pattern identification and treatment, kind of really bringing together and finally giving like a structure, a more, clearly viewed structure to the idea of Wen Bing, right? You have this idea of Shi Xi, right? This perverse or evil Qi that can come in. This is the idea of a pestilence, some type of evil sickness that can affect you, right? Li Qi, the pestilent factor, right? We talked about this. Fu Qi, the idea of something that comes in your body and sits latent and we haven't talked a lot about this. We talked a little bit about the fact that we can move these things via divergence, and we can take the pestilent factor and we can move it and hold it in latency. We haven't talked about the fact that some of these things can be caught in one season, sit in dormancy and come in another season. That may be in a future class on Wen Bing, right? But we haven't discussed that here yet. So we talked about the 4 types of heat, right? Initial stages, right? All these things, the exuberant or critical stages, right? Recovery or death, right? Then we talked about diagnosis, right? The pulses, and we also talked about the idea of some of the different pulses. Again, these are just overviews of different pulses. They're not necessarily everything you'll see, but to try to give you an idea of what heat can do and how it can affect the body and consume yin, right? Cause blood stasis and all these things, right? Tongue diagnosis, we talked about tongue diagnosis. We went into tongue diagnosis in a decent amount. We talked about the levels of the tongue as heat moves in on the tongue, and that compared to the idea of overlaying organs on that and seeing what's affected, right? if you look at the tongue is kind of matched up as what? When you look at the bottom of the tongue here, this is really like the upper jowl, right? So as things move in, right? So upper jowl, middle jowl, lower jowl, right? So you can see that kind of idea of the San Jiao aspect on the tongue, and so that you're going to be able to see how the San Jiao is affecting the tongue as well. All right. Okay. All right. We talked about tongues. We talked about tongue bodies. We talked about swelling. Right. Remember this swelling. I'll just give you guys a hint. Remember this idea of a swollen tongue, because in the case studies today, you're going to see a case of a patient with a swollen tongue. And let this give you an idea. Remember, swollen tongues come from, in Wen Bing theory, come from heat spreading, right, causing this swelling, this pushing out, right, because Yang expands, right, so it causes this, pushing out. So this is this idea of swelling. All right, we talked about spots on the tongue, things you can see, right? We talked about cracks, the centerline crack that forms in the Wen Bing disease can be due to the idea of excess heat in the stomach, right? This could be a pathogen that moves into the Qi level, right, and creates heat in the stomach. Or something that could be long-term, an idea of excess stomach acid for a while, so these different ideas in Wen Bing theory. But if you're seeing a tongue that the person catches a Wen Bing disease and then they develop a stomach crack in the transition, you're looking at this pathogen having entered the Qi level. All right. So there's dryness. You can see cracks or drying aspects across the tongue. In a dryness, in a tongue that's affected by dryness, in a body where the yin is being consumed by heat, you can see these kind of these horizontal lines or cracks in the tongue. We talked about creases in the lung yin. We talked about papules in the front that show up on the tongue, these red spots that are a sign of heat in the upper jowl. That's affected the yin level, but that's in the upper jowl affecting the heart, right? So we talk about thorns and projections are really a sign of heat, usually binding in Yang Ming, right? Talk about analysis. So just going over a little bit of this. This is one other one I want you to remember. This is kind of one that throws you off, a lot of people off. A slippery, moist, gray tongue. A lot of people don't think of heat, right? Remember, heat is consuming the yin and the yang, right? In a case of somebody with a Wen Bing pathogen. So in the case of this happening, you're going to find that this is Ying level heat. This is heat that's gone all the way through and really consumed a lot of the Zheng Qi, destroyed a lot of it, consumed a lot of the yin. So you start to notice, we obviously have yin deficiency, but you have a lot of yang deficiency. The person actually did hit really hard in the yang area. And so what happens is you can see on these people who have, this comes along when it finally gets to the Ying level where you have a lot of deficiency in the body. It's still a Wen Bing heat pathogen, but they're seeing signs of cold and spleen deficiency because the spleen was hit hard by the heat, right? So it loses its spleen chi, it loses its ability to warm the limbs, right? So pay attention to this. This is going to be another sign. I'm giving you a couple clues to the case studies today. This will be another one of some case study. All right, skin diagnosis. We're going to go over this a little bit because we want to see this later on. We'll just get through it pretty quickly, though. And when I say pretty quickly, relatively quickly, we have a whole day, and we'll get into the treatments and everything else. I just don't want to run out of things to teach. So, all right, let's see. So, Wen Bing diseases, right, can create a tremendous amount of heat and affect the skin, right? So you can have these rashes or macules or papules pop up, right? Sometimes called maculopapular eruptions. We talked about this. We could also have blisters, Malaria alba, right? So that's the idea of Malaria alba. So in Chinese, you call these rashes of macular papules, we call them banjian, right? So you have this idea of these eruptions that come up due to different things. Macules will be spots, remember? You can't feel them, but you see them. And you see these kind of, this area of swatches or stripes appear on the skin, right? But they can't be felt. Whereas papules, you can feel them. They are bumps. Like after when you gua sha and you run your hand over the area, you can feel a little bit of bump. They're like the size of millet. They're really tiny grain millet. This is or quinoa for some of you guys who don't know what millet is, or chia seeds. That type of real small size. So it's that type of size, and you can feel that just under the skin when you have heat that moves into the Luo vessels from hand taiyin, from the lung channel. All All right. Let's see here. It's down at the bottom of the screen. Perfect. All right. So macules are a sign of heat in Yang Ming. They're heat toxins, Yang Ming toxins that are formed in Yang Ming, and they're pushing out into the muscles, into the flesh. Papules are a sign of wind heat in Tai Yin. And they emerge out through the blood, out through the Wu vessels, right? So these are the differences. So where you're treating heat, you have to know that you need to treat heat in Yang Ming when you have macules. If you have papules, you need to treat heat in the lungs. You need to treat heat in the lung channel, in the upper jiao as well. All right. So as Wen Bing pathology enters the blood levels, the blood and the Ying levels, it stimulates the blood and moves, right? It can move the blood in the vessels. So it causes this expression outwards. Right? These skin presentations should be used in conjunction with other symptomology. We talked about that yesterday, right? So rashes, whether macules or papules, that are consistently red and clearly defined, this is a good sign. Remember, when they're dull, when they don't really express, when they kind of sit under the skin, this is not good. It's a time the body is unable to thrust out, the Zheng Qi is unable to push the Shi Xi out. It's weakened, right? So we want to help promote the ability to push this stuff out. Audio is kind of wobbly. Okay, who else is having trouble with audio? Is anybody else? Is the audio a problem for anybody else, or is it okay? It's in and out. Okay, yes, problems. All right, everybody's having problems. Donna, do you want me to log out and log back in? Or maybe it could be some people's connections. What are you feeling there, Donna? Is everything recording well? All right, we'll keep going until Donna says something, because this is a review, so we don't have to worry too much. So rashes. So rashes, these rashes are consistently red, and if they're clear, then we can, then what happens is that we can see that the body's trying to out thrust things, right? If they're not so clear and stuck under the skin, then the idea is that the body's having trouble out thrusting the stuff. The Zheng Qi might not be up to the task, and so you have problems with that. So you're going to need to support the Zheng Qi to help out thrust the heat, right? The Shi Xi. All right. So dark red, the darker the macules get, kind of like the tongue, just like we see on the tongue, we see this present in the blood, right? The darker the tongue gets, the more intense the heat is. The darker the spots are, the more intense the heat is, right? The darker, the more purplish, the more idea of heat in the blood level causing extreme conditions in blood massing, blood stasis, right? Just like on the tongue, same thing, more crimson, purple starts to turn, the more you know you have heat affecting the blood, you can get massing blood stasis, right? Dark blackish macules are a really serious sign that Zheng Qi is really, really in a bad position, and it's not dealing with the condition that you have. Papules that appear to float, right? They kind of like islands. You have a little bit here and a little bit here and a little bit here. This is a good sign, right? But if they're two together, they're two bound tightly. They're like trying to push out and kind of like trying to push into each other's area, right? This is a sign that you have heat toxins, deep heat toxins forming consuming Yin. So you want to help to assist the body and clear these heat toxins out of the body, and then nourish Yin in a case like this. All right, skin rashes. So got another thing here. All right, I sound very far away now. I don't know. I didn't move anywhere. I guess it's just a sound thing. But if it really gets bad, we can always see if I can adjust. And that's strange. Yeah, I don't know. I don't know what that is. It's changing. No, nobody's blocking mic. In fact, the mic is directly in front of me at the camera, so I don't know what that is. Nothing blocking my mic. So these skin rashes must be taken into consideration, right? And this is how we want to watch the person's pathological process, the development of things, to see if they're getting better or getting worse. We need to develop an accurate treatment, right? It's bad now. No, we don't have a microphone. I'm not going to set one up because it's too many wires. We tried to do it before. I don't know, Donna. maybe you, should I log back out and log in? Everybody's saying that it sounds like I'm in a tin can. All right, some people, I guess, don't have the issue. Some people do have the issue. All right, well, we'll keep going. As long as you can understand me, you can understand me. So, all right, let's keep going. Like a spy mic from the 50s, exactly. All right, so we'll keep going. All right, Sam says I should check the microphone selection, so let's do that real quick. All right, let's see here. Let me just see if I can check my mic selection real quick. Microphone selection. Let's see if this can help. Let's see, microphone. Here we go. All right, guys, because it's being an issue, hold on real quick. Let me see if I can get Sam on the phone and we can fix this. Give me 5 minutes and we'll see what we can do. Hold on. All right, we're back. How does that sound? Does that sound better? We just adjusted things. Yeah, much better? Okay. All right, let's get back to it. We just adjusted a mic. All right. Okay. And then here, hold on real quick. Let me just set up the screen viewing again. Good. We're good to go. All right. All right. Yes, Wu-Tang strikes again. All right. Let's do it. So we are back. Here we go. So rashes must be taken into consideration, right? This is like with anything else, Wen Bing pathogen, because things change very rapidly, right? So you have to look at all these different things that are playing a part. You can't take one thing as definitive diagnosis. You have to take all these things together, right? As with any good differential diagnosis generally, right? So, so we take these things into consideration. So we talked about how when you have outbreaks, maculopapular outbreaks, you use these to determine the suitability for a treatment and the patient's condition, right? The more clearly expressing they are, that's great. They're not expressing so much, you have a problem with the Jiangqi being able to push things out. They're expressing and they're super close together, you have heat, and you have the Jiangqi could be in critical condition, right? So you have a lot of yin toxin or heat toxins deep that have consumed yin in that case, right? Particularly because these eruptions are a sign of the effort of the body to clear to outthrust heat toxins. We want to support this, right? We mentioned yesterday we can use certain dietary measures, right? We mentioned coriander yesterday as one, but also needling to help outthrust from the chi level, right? To help outthrust things. That's a big, important treatment principle in this case. So in cases where the rashes fail to develop, right, or they have a weak development, they're unclear or indistinct, right? This is where you have this idea that the Jiangqi is unable for some reason to resolve the Shi Xi, right? The heat is now blocked internally. It can't move outwards, right? So we need to promote this movement of heat outwards. We want to get this out of the body, right? We want to get these things out of the body. So we have this idea here where we have this, we want to help to promote, like in macules, for example, you have this heat from Yang Ming penetrating the blood. We want to help to promote the cooling of the blood and transforming of macules. That's the goal, right? Papules is more wind heat in the tie-in layer penetrating the low vessels. So therefore, in this case, you want to outthrust, right? And so you're going to see this is different with needling treatment. One is going to be clearing heat from Yang Ming, right? Stomach 36. The other one, outthrusting, you might be, for example, bleeding governing vessel 14, right? Outthrusting the qi, right? GV14, Da Jue, right? Li would be the idea of bleeding stomach 36 because you have heat and yang ming. So these are differentiating aspects of treatment that really make a big difference on presentation, right? Acupuncture can be very specific. I know a lot of times we talk about how it's, a lot more forgiving than herbs and herbal medicine and this and that. But I'll tell you what, I was on the phone call with Tina Chen last night. We were just talking about some things, and we mentioned one of the things is that the bar to get over to really get into herbs and really get your footing feels like it's higher than acupuncture. But in many cases, like the need to get, or the when you get, it takes longer to get better at acupuncture, much better at acupuncture over time than herbal medicine, right? That's where you get these miraculous things happening when people do acupuncture. It seems almost like magic. Things are like really, really, really simplified, but like done in a very specific manner, because the level at which you can climb in acupuncture is sometimes higher. And this is something that is really important. One of the things why I really enjoy, I love Chinese herbal medicine as well, but I really enjoy acupuncture for that reason. You have to be really, really good at acupuncture to get these results. And so you want to be able to cultivate these skills through good study, through practice in the clinic, but also through self-cultivation, right? Training the sinew channels, right? Training the ability for the body to release through the fingers qi, right? Or to be able to conduct and move through the hands, right? From the feet through the hands. Practices that would create this strength, this ability to needle, come from things like I and Jing, right? Or like this idea of I Jin, the changing of the tendons, right? Muscle tendon changing practice. A good friend of mine, Sharif will be teaching. He is a lineage holder, Hung Gar Kung Fu. He's actually formulating a class right now for NCC AOM that will teach sinew changing from his Hung Gar lineage. Is a very, very high level from Frankie lineage of Hung Gar, and he's going to be teaching how to develop that power from the hands, particularly for acupuncturists, through the sinew. So if you guys are looking for classes to help you, produce better needling skill, right, and technique, I would highly recommend any of Sharif's tendon changing classes that he'll be teaching for acupuncture. So if you guys are looking for that, that will always make your needle technique better, and it'll make your ability to treat things like this, along with the knowledge of how to treat it, it'll make it that much better so you get results. A lot of times, it can be a mixture, right? Some people might not know exactly differentially how to treat something, but then other times their needle technique is just not good enough, and so you need to have both at a very good level. So his name is Sharif, and you can look up Bay. I think his name is Anael, Anael. This is that, but he's a Moor, so his last name is Bay. They carry the title Bay. So he is. You can find him on Facebook. He's phenomenal. His Hung Gar is top notch, and he does a lot with his. They have a family medicine within their Hung Gar lineage of DTOP medicine, of Hitfall medicine, from his teacher Frankie. I don't know if he'll be teaching that, but he's going to be teaching the muscle tendon changing. So I would definitely include that there. Some people like the Chinese. I'm glad to see that. I avoided putting a lot in this time because there was a lot of complaints for it last time, but I personally believe it's important. So if I do classes in the future, if I don't retire after this class, maybe I'll do a lot more Chinese so that people can understand it. All right. So here we go. So malaria. So Miliaria alba, right? It's this idea of Bipay, right? Bipay is this idea of these small fluid-filled blisters, right? And they appear on the skin, and you can have issues with, this is like this idea of you have this heat that's welling up, this damp heat that's steamed in the chest, right? Somebody says that they didn't get the name clearly. Sharif Bey, I posted it here in the group to all panelists. Just look above. You see that I posted it there. I posted his name. So this damp heat will steam in the chest. It has trouble getting out, right? The body's trying to outthrust it. It's unable to, right? And then what happens is the body finally gets to push it out through lung diffusion. It's trying. You feel chest oppression because this is dampness, this heat steaming in the chest. The body finally creates a fever and it sweats. And upon doing that, you get outbreaks of these small blisters, generally on the neck, on the upper chest, on the upper abdomen, on the upper limbs, generally is where they mostly come, right? Because it's pushing upwards. Normally, this stuff is stuck in the upper jowl as it's trying to push out, right? If these are coming out in the lower jowl, in the lower legs, then the idea is that you have dampness steaming in the lower jowl and that you need to treat that. All right, let's see. So somebody asked about his name. His name is Sharif Anel Bey. So I posted it in the chat so you can see it there. Mine is, oh, okay. It's not set to all panelists and attendees. Okay, let me try this again. Sharif Anel Bey. There you go. That's his name. You can find him on Facebook. I strongly suggest adding him. Like I said, his Gongfu is top notch. His ability to teach these techniques are top notch, and this will be coming out. He has a Gongfu school in Syracuse, New York, traditional Gongfu. They teach lion dance and everything else, but he's going to be teaching this class on sinew channels and developing power in your hands for acupuncturists, tween op practitioners. You know, it's generated from the feet, but how to get the sinew channels to connect. So he and I have been talking and going back and forth on a lot of this stuff. So he's been developing these classes. So it'll be really, really, really cool. All right, so here we go. So this is his damp heat, right? It tends to get sticky. That's why it's heavy. That's why it doesn't push out easily, right? That's why you feel chest oppression, right? It's difficult to diffuse. The lungs are attempting to diffuse this. It's attempting to outthrust this. This is a reason why it generally doesn't appear all at once, because it pushes out a bit, and then it settles back for a bit. Your body settles back, and then it creates another fever, and you sweat, you do this again. And as you do this, the person should be getting a more clear consciousness, or conscious, right? They should be becoming consciously clear, right? Their spirit should become unclouded over time. If it's not becoming unclouded, then you have a problem. You should find that the person who's, you know, they're sick and they're you know, kind of restless and they're back and forth as they have these fevers, as they have these sweats, as these things press to the surface after a few times, they're not as restless. They breathe easier, right? They don't feel like their mind is as clouded. These things should be happening. If they're not happening, then that's a sign that this heat is steaming and it's not getting pushed out, and the heat could be actually falling deeper into the body and creating more heat toxins, right? All right. Connection between the lungs' ability to diffuse, to outwardly diffuse its qi, is this sign of diffusing the qi, and so it can push this stuff out, right? Like we said, right? So we said prior to the outbreak, person can feel a fever, they feel chest depression and stuffiness, right? Because this heat is trapped inside and it's steaming, right? The steaming dampness, right? So here's this idea. So the vesicles on healthy Malaria alba, right? I always pronounce this wrong. It's Malaria alba. I keep calling it malaria. Is these vesicles, these blisters are like plump. They should be formed with clear fluid inside. Sometimes some people say they like kind of glint or sparkle, right? They're bright when they're under the light, right? Because this is clear fluid. That's kind of, you know, you see it in chickenpox, and people have chickenpox and these different things. So this is a sign that there's sufficient yin fluids. This is this yin fluid pushing this damp heat up through the surface. You're sweating, right? You can push this stuff out. This zheng qi is sufficient to push out the Shi Xi, right? However, if this is a dull, not really full blisters, right? They lack fluid. They contain no fluid, or they're often deflated. This is a sign that they tend to lack a clear outbreak, and the mind might not become clear. The pain is still there. This is a sign that yin fluids are exhausted, that qi is exhausted, right? The zheng qi may not be sufficient to deal with the Shi Xi, right? So we're just reviewing this a bit. Have I seen miliaria? Yeah, I had chickenpox as a kid. Have I seen it in other patients? Yes. You can sometimes see it come out on shingles on some patients. Generally, it never comes to that, but sometimes it can come to shingles blisters. This would be an example of that. But on chickenpox, for example, on patients who have some sort of pox outburst, some sort of eruptions, that's miliaria. So you can see it there. And it's very easy to treat. It's not hard to treat. You can clear the heat and clear the dampness and assist the lungs in diffusing their qi, and it gets better very quickly. I still have scars from my chickenpox. Not a lot, like little dimples on my skin, but that's, they look mostly right now like white spots on the skin where like if you get tan, because I'm Sicilian, so I can get like golden tan if I'm ever out in the sun. And then around the area where the pox were, it's a little lighter. And that's that example of where those miliary alba were on me when I was a kid, mostly on my shoulders, right, my upper chest. They're not many, but a few. All right, so in conjunction Wen Bing, you can see that if the person's clearly pushing out the miliary alba, you can see that the person's yin and qi are sufficient, right? The zheng qi is strong. You can clear heat and transform dampness, right? If it's not, if the patient's yin qi is insufficient, you're going to find difficulty with this, right? So in this case, you're going to want to support their yin. You're going to want to build their yin. You're going to need to nourish fluids. We talked about clear broths for you guys yesterday that I mentioned, the website, the YouTube page, Wok Drop, WOKDROP. They have great soup broths on there. They have great soups that are really easily digestible, and they're making more. It's my best friend Simon and I. He's the chef, and I'm the doctor of Chinese medicine. And we put our wits together to create this channel. So this idea so you can use soup broths like the one that we taught on there to assist you in developing yin, right? And developing yin qi, making easily digestible foods, zhou, right? Kanji, warm water, right? These type of things that help to promote the yin fluids and promote the yang qi for the body to push things out, right? All right. I see someone has seen miliary alba in elderly patient. They kept telling her it was from spider bites and kept giving her steroids. Steroids kept messing with the diet. Well, a lot of times you get steroids. Why? Because steroids will suppress. They're cold, right? So they can cool things. So they can suppress the lungs' ability to diffuse, right? They suppress kidney yang, right? And they can injure spleen yang. So in this case, you have trouble with what? The lungs. They'll suppress the lungs' ability to diffuse up and outwards, right? With steroids, they're very cold, right? And so they'll also tend to weaken spleen yang or spleen qi, right? So you'll start to get more dampness, right? And then on the top of that, it'll suppress the kidney yang because they're cold. And so you're not going to have the ability of that yang qi to push upwards to support the way to get things out of the body to help the lungs diffuse, right? So this is what happens when somebody's given steroids for things that don't assist in the out thrusting, right? I find steroids make this worse as soon as these patients complete a regimen. Yeah, well, because you have a lot of cold. You have a lot of cold inside. Now you have cold dampness inside. So the body's trying to steam this stuff out, and instead we're kind of like building an igloo around it, right? Instead of allowing it to go out, we're kind of creating an igloo. And remember, cold and damp are really good insulators. Cold and dry are also really good insulators. You can have layers upon things in the body that are sandwiched in different different environments that are sandwiched, just like the world, right? Look at the world. We have, poles that are they're supposed to be pretty cold, although, they're kind of warming up right now. In general, they're supposed to be cooler, right? And you have areas of the world that get cooler and warmer, and they're all kind of sandwiched together, and they're all moving around, right? This is the body. This is what happens. I mean, these, cold blocks of ice are phenomenal insulators, right? Igloos are a perfect example. I was a Boy Scout. I was an Eagle Scout. I did a lot of survival training and stuff in Scouts. And, you can create and reinforce really insulated areas in the snow that insulate warmth, right? By digging down in the snow and insulating yourself in the snow, you can actually maintain warmth in your body, So steroids can do that too. It can maintain the damp heat sandwiched between layers of cold. So that's something that can happen with steroids. So it can, it's not exactly the most ideal treatment or effective treatment. It's just the most commonly given treatment in hospitals and among Western medicine, right? So we talked about this. So with a fever now, fever diagnosis, right? Because this is actually what I wanted to start with today. But we went beyond this a bit. So, all right. So fever diagnosis. We have this struggle between the zheng qi and the shi qi, right? This is created by the action of the wei qi struggling and the heat pathology, generating more heat, right? And then ultimately it can burn through yin fluids, right? Particularly those which are ascended by the stomach, right? It can injure the stomach. When this heat enters the qi layer, it can enter yang ming, and it can burn through the fluids in yang ming, creating more fever, right? higher fever and the inability to push this out. All right, so there are two categories for fevers, right? One in Wen Bing. One is this excess fever from a full pathogen, from like a pathogen that's like a replete pathogen, something came in from the outside, right? And then you can have something that's a deficient fever from a yin deficiency, right? And this is the idea that the pathogen is eaten through the yin of the body as it's moved deeper and deeper. And so now you have like yin deficient heat, right? So you can have 5-POM heat, you can have fevers that get worse at night, right? So you can have these type of things going on. And so these are two different things to look out for, because you can also have them happening at the same time. You can still have full heat, replete heat, and you can also have deficient heat forming due to the replete heat. So you can have fevers during the day, right? And then at night, you have a low grade fever, right? And that's a sign of, or the fever starts low grade in the afternoon, it kind of subsides. It's higher during the day, and then it subsides a little bit, and then at night it starts to go up again, right? This is a sign of yin fluids, yin deficiency, right? Because of a replete condition. So first idea though, how do we tell if, say, a fever with all these other symptoms, say we have a floating pulse, it's rapid, right? The person has sore throat, right? Maybe they have a little bit of coughing, and they have fever with aversion to cold, right? This is a sign of what? A way level pathogen, something that's coming just the outside, right? So it's coming the outside, it's gotten stuck in the outside. We want to promote this functioning of clearing wind heat, right? This is in a way level. So in this case, you want to promote the clearing of wind heat here. So this is a fever with aversion due to cold. This is a way level pathogen in Wen Bing. You would be clearing the way level, clearing heat, clearing wind heat, right? Promoting sweating, assisting the lungs in diffusing if there's a problem there. Alternating fevers and chills. This is a sign that a heat pathology is stuck in the way, between the Wei and Qi, right? So the idea is it's trying to move in, right? What's the pivot between the Qi layer, the internal layer? This is essentially like Yang Ming, right? And the Wei layer, almost like Taiyang, right? It's Xiaoyang, the pivot, right? So this would be something where you have heat, wind heat, could be damp heat, stuck, depending on the symptoms, right? Stuck in the Xiaoyang, the foot Xiaoyang channel. It's going back and forth. Maybe it's stuck in the foot and the hand Xiaoyang channel. You might have to use the Sanjiao. You might have to use the Sanjiao channel and the gallbladder channel. So if it's in the Xiaoyang foot and arm, or if it's more severe, if you're finding these half and half patterns that are more severe, remember back to our class on Shanghanlun. You might have to use both the hand and foot Xiaoyang. If it's not as severe, maybe you just use foot Xiaoyang. So those principles can carry over, those principles of how to apply things to the channel. For you guys who did not take the Shanghanlun class, go take it. It'll go into a lot of this understanding. And for you guys who have taken the Shanghanlun class, maybe you can tell your fellow classmates why they should take it. You can give them some ideas. But the idea, just a brief idea, is that when a pathogen is less severe using acupuncture based on Shanghanlun theory, you needle and treat predominantly the foot channels. When you have a more severe pathogen in that level, you treat both the foot and the hand channels. Now, we're not necessarily treating using the 6 levels per se in this, because this is Wen Bing based acupuncture. But if you know something's stuck in Xiaoyang, then you can clear it out, and it's not so severe. You can clear it out with the gallbladder channel. If it's more severe, you might also use the Sanjiao channel. Why? If you want to take a Sanjiao pathogenic mechanism idea to it, the idea is that the Sanjiao channel can carry a lot of heat. You can clear heat extensively through the body using Sanjiao points. I will get into this more later today when we get to Sanjiao pathomechanisms. And we'll talk about this so you'll get an idea. A lot of people don't realize how many points in the Sanjiao channel clear heat. And remember, we talked about how in the Shanghanlun class, at the fingertips, you have the Jing wells, right? And then you have the Ying springs and the Shu streams and the Jing rivers and on and on and on, all the way to the Husis. This is a slow increase of depth in the body. So Jing well points treat the exterior and exterior heat, right? And as you get deeper, you'll treat more interior heat. And you'll see this. So if you look at, if any of you guys has a book, say, a book on use of acupuncture points, and you can look up acupuncture point usage, channel usage, you'll see that a lot of times these points will follow this idea. You'll notice many times in general they'll be treating deeper and deeper and deeper and deeper conditions as they move into the body and the channel gets more broad and deep. So the same thing, Jing well points on the Sanjiao channel will treat more external things, and so will the Ying spring points. But as you start to move in, you can start to treat deeper and deeper heat, right? So this is this idea here. Just preparing you for later stuff. All right, so an unrelenting fever, right? Something that's very strong, it doesn't let up, you know. This is the idea that this pathogen is moved to the Qi level. We talked about this yesterday. It's moved into the Qi level. The pathogen is now stuck, or is now in this struggle, is in between, really strongly between the Zheng Qi and the pathogen, right? And the struggle has gotten stronger, right? This is the idea of Yang Ming really giving up its fluids to support Wei Qi, right? This is this idea we also talked about in the Shen Lun class. You will get more heat when Yang Ming gets involved. Yang Ming has a higher quality of Yang Qi, not necessarily more. So you will get more refined Yang, you will get a higher heat. This is this reason. In the Qi level, if it's moving in, chances are, and the fever is really unrelenting, it means that the heat is in Yang Ming in the Qi level. That's the sign here. Afternoon tidal fevers. This is this idea that heat that has been in the stomach for a while, it's been in Yang Ming, has now consumed Yin. So it's in the sense of like Yang Ming has been battling it, but it's been losing its Yin fluids. So now you can't maintain this full fever anymore. So it starts to become tidal, right? You start to get this idea where you get this heat that flares, but it can't keep it going up, right? It can't keep it going on. So what happens is the Yin deficiency in the stomach starts resulting in upflaring of fire, right? It's a full heat condition, but the Yin deficiency is starting to come on, means that it's not just in the stomach anymore. You start to get this upwelling of fire moving upwards, right? Because the Yin can't anchor this heat. And so you start to get the idea that the Qi from the stomach, it should flow to the heart, right? And then flow down into the body. We talked about this yesterday, small intestine, bladder, kidney, these are all in the lower jiao. Instead, you'll find that a lot of that heat will start flaring back upwards again, right? Instead of moving down the body to allow the Qi to move down, the Yang Qi to move down, you'll get this heat in the afternoon, this tidal fever, right? You'll start to get the heart and the lungs affected, right? So you'll start to feel this heat that builds strongly, right? It'll invigorate blood. You can get bleeding that occurs because it can affect the blood and affect the heart. A fever that's unsurfaced, right? That's sitting just under the skin. You can feel like the skin just under the skin is hot when you press, right? Or it's not very strong fever, it's very weak. This could also be accompanied by oily sweat, right? This is this dampness in the Qi level, right? It's holding things down so you can't get the heat out. Sometimes when you press the skin on the person, it hurts, but you press through and you start to feel heat. If you press down through the surface of the skin, the heat is more down in the deep area of the skin. The skin's oily, sweaty. You know, this is this idea here of damp heat, right? Lingering heat that's sitting under the skin, which can't produce a lot. It can't be very productive and pushed to the surface to clear this pathogen because of the dampness on top, right? This will result in smoldering heat, right? Smoldering underneath, eating through Qi. This is what affects the spleen, right? Heat affects the spleen, burns up spleen Qi, produces more dampness. Now you get more dampness insulating and more dampness insulating as the heat keeps eating through all of this postnatal Qi production mechanism, right? And so you really destroy a lot of the ability to make Qi and to make refined fluids make Yin. Evening heat, night fevers, right? So this is a sign when generally the pathogen has gotten to the Ying level. It's really affected the Yin. It's eaten through the Yin. And you have this as a result of that, right? So you get these night fevers, this evening heat or evening night fevers. So a night fever that's relieved at dawn is an idea of both Yin deficiency, but also lingering heat in the Qi level, right? So this is the idea of this. You have a Yin deficiency obviously going on, but you still have heat in the Qi level as well. So you need to treat that. Low fevers, right? So this is a sign of deficient liver and kidney Yin that is being consumed, right? So in this case, it's probably a deficient heat you're looking at. This is deficient fever, a replete fever, right? So this oftentimes occurs after a pathogen has really made its way through and it's in the final stages. The person might not be upon death, they might be recovering, but they still have these low-grade fevers. They come on at night. It might not call it a low-grade fever. Remember yesterday I said some people might just say, I feel hot. I had one patient who had corona, and when they came to me after they had recovered, this person only found out about me after they had recovered from corona, not during. And they said around 6 o'clock, I can set my clock by it, I get hot. He didn't call it a fever, but he called it getting hot. And he said, I'll remain hot through the night. And I was like, that's a yin deficiency, right? So that's a yin deficiency because there was a consumption of yin all the way to the Ying stage due to the COVID virus that you caught. How about hot flashes induced by hysterectomies, chemotherapy, breast cancer? Do you treat this as severe yin deficiency in Wen Bing? Yes, absolutely. Not just severe yin deficiency. You would treat these things as hot pathogens, right? So you're dealing with, chemotherapy is very hot. It burns, right? It burns the skin. It burns what's going on to clear things out, right? So these things could all be treated as hot pathogens that move into the body in this case, and get deep into the body, particularly when you're doing when you have something like a hysterectomy and chemotherapy, you're immediately going to have blood stasis, right? You don't have to necessarily move. In this case, they cut through the Wei level, the Qi level, right to the Ying level, right to the lower jiao, right? They didn't go through the upper burner, the middle burner, the lower burner. They cut right to the lower burner, and they started messing around and taking things out. And so it resulted in blood stasis, inflammation, right? Because you're cutting through tissue, it's creating inflammation. And the chemotherapy was used that created further inflammation, right? So all of these things will create what looks like a lower burner Wen Bing pathological issue. So you could use it, you could take it like that and see what kind of treatment results you get from there. You could also look at it as something that affects the Ying. And so you want to clear heat and nourish yin, and you can see what happens from there. I think that would be a really interesting experience to treat that using those things. I have never done that. I've never used Wen Bing to treat that, but that makes total sense why that would work like that, particularly as you use a Sanjiao overlay to see where the blood stasis is happening, and particularly because blood stasis is can happen due to the yin deficiency, right? Due to this yin deficiency happening and this heat that's in the area. So absolutely, you could use that to treat it. What did I use at the time? I was using, when I was treating hysterectomy issues, I oftentimes use Sanjiao, but a lot of times I'll use the dye channel to help clear things out, and then I'll nourish yin. If there's a lot of stasis in the lower jiao, I'll use the dye channel if there's been a lot of scarring and whatnot. I'll sometimes use for hot flashes, I'll nourish yin, but then I'll do things like if I notice there's a problem with, depending on what's happening, if I know there's a problem with the kidney yin and kidney jing, I might use a bladder kidney diversion to anchor yin or anchor yang with the yin by consolidating the jing to help anchor the jing, the yin aspect of jing to help anchor the yang from floating up. So there's a bunch of things I've done. It depends on the different patient. Anybody who's worked with me in clinic will tell you that I use a vast array of things that all integrate, but it's not like I'm using them together in a large understanding of how the body works in a multi-layer system. So that's kind of how I do things. So absence of sweating. So here we go. I think we did this yesterday. All right, cool. Let's go over this more. So in the Wei level, this is a sign of heat, right? So heat comes in and you can sweat. The Wei Qi's trying to push out, the yin fluids are trying to push out, right? So the pores are open, right? This kind of sweating can all be due to wind heat. But if the wind blows the pores shut or the heat blocks the Wei Qi from opening the pores, from regulating the pores, you might not sweat, right? You might find that the person isn't able to sweat, right? If there's more wind in this, they can tend to have more chills, right? If you have more damp heat, you're not really in the Wei level, you probably won't have the chills. But the wind heat, you'll have more chills because the wind is blowing, right? And then it can block the pores, it can block Wei Qi from moving in the vessel. Remember, the chills come mostly when the movement of Wei Qi is blocked, right? That's generally when this happens because it can't warm the muscles, right? When pathological heat enters the Ying level, it severely damages the Ying Qi and the Yin fluids, right? So if it moves into the Ying level, even at the Qi level, it can start. When it severely starts to damage them, you'll notice a decline in sweating. Now, in the Wei level, you could notice a dry tongue, but you still might have sweating because the person is not that severely damaged with fluids. But as that tongue begins to peel, as the heat moves deeper and deeper and deeper from the Qi level to the Ying level, you'll notice that the level of sweating declines, right? So you'll notice that declines like that. And so in that case, the heat will become trapped inside because it no longer has a vector to ride out the body on, right? This is the water fluid, yin, is used as a vector to help move heat, right? Think about this. A lot of times we say that bitter herbs, let me use a herbal explanation, bitter flavors, right? Clear heat, right? But have you ever put bitter on your tongue? When you taste something that's bitter, what happens? Your body starts to produce more saliva. So it stimulates this fluid to help move something, right? Move the flavor or move the heat. And we just found out so we know that it creates this fluid, and that fluid can then become what? A conductor of heat. It can move things to a direction, right? So it can translocate, it can move things in different directions. So that's one of the aspects of this, is using fluids to move heat. But when you don't have them, you oftentimes can't sweat, right? So now you can't move heat. So then the heat gets trapped inside. You start to notice issues of vexation, irritability of the heart, remember, or agitation, restlessness of the liver. Remember, limbs that are moving. Could be the person tapping their foot, tapping. Could be restless legs in bed, right? Could be them fidgety, right? This can all be restlessness of the liver, right? So we said fanzao, right, is this idea of irritability or vexation and agitation. Vexation relates to the heart. Agitation relates to the liver. Fan relates to the heart. Zao relates to the liver. So this idea of this heat affects, and so you'll have different symptoms. Irritability of the heart will make the person irritable. It'll irritate their spirit. They'll feel irritable. Restlessness of the liver is more about not being able to sit still, constantly moving, rolling back and forth in bed, this type of action, right? So this heat is trapped inside, affecting the liver. So you can have intermittent sweating, right? This usually occurs when fevers, this usually occurs with fevers and tends to reduce the fever, but then the fever rises again, right? So this is this idea that there's dampness. So the heat comes up, then dampness covers it, and then it steams internally. The heat rises with the steam, it comes up, then dampness covers it, right? So you get this intermittent fever. Great sweating. So you remember how we talked in Yang Ming? So we have this idea in Yang Ming that you can have the 4 greats, right? So great sweating is one of them. So this occurs in the Wen Bing idea when heat enters the Qi level, right? This is the idea of it entering into the Qi level and affecting Yang Ming, right? Affecting the stomach, right? And the large intestine. So this can come with things like great thirst, great fever, vexation, right? A large pulse, right? So you can get this really big pulse, this rapid flooding pulse in this case, right? You can get a dry mouth, right? You can get a clouded spirit. So the body can't think, the mind can't think. What's happening? Where is this going? What's going on here, there? These things, they're not able to make, conscious observations and reactions to them, right? Maybe the person's starts to become a little delirious, not completely delirious, but they seem like they're not so responsive, right, to when you're talking to them. If these things occur with great sweat, all of these things occur with great sweat or non-stop sweat, like the body just keeps sweating, keeps just soaking the sheets, soaking the clothes. It's like water's just kind of flowing, dribbling out of the body, right? This will ultimately result in, if it's not treated and stopped, this will result in the yin desertion, right? This damage to yin, because it's deserting you through the pores, right? It's leaving, right? So you get this yin desertion. Right. And when you get the yin desertion, what can then happen over time is that you start to get you'll start to get the heat build in the body, and you get really, 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 really hot. However, if this great sweating is accompanied by cold limbs and a pale tongue and a hidden weak pulse, this is a sign of yang desertion. So this is a sign that the yin is already so deficient that now the yang is no longer contained in the body. The structure of the body can't even contain it. And now that's starting. So this is basically kind of like the person's going into shock, right? So you have this great sweating is accompanied by cold limbs, pale tongue, and a hidden and weak pulse. So you want to look at that. With this sweating, is the person is there heat trapped underneath? Probably most of the times that's what you're going to see. But if they've had this for a while and suddenly they turn cold, they're starting to feel cold, the tongue starts to look pale, the pulses become hidden, right, and very weak. Now you're noticing, sometimes you'll feel for a period of time when you're taking those pulses, you'll start to feel them floating even though they're hidden and weak. You're actually physically feeling the yang qi leave the body. That's what you're feeling in the pulse if it starts to float. In that case, you're starting to feel that yang move up and out of the body, and then it becomes hidden and weak, right? So in that case, you've got a problem because you've got yang qi desertion. Now you have to still clear heat, but you're going to have to nourish yin and anchor yang in the process of that. So that's just a compounding condition there. All right, shivering sweat, right? So shivering sweat. This generally occurs. What happens is what generally occurs first is the whole body begins to shiver with shivering sweat. So the whole body shivers, you feel chills, and then it's followed by this heat and this sweating that comes out underneath it, right? And this normally happens when the pathology is in the qi layer, right? So this pathology is struggling with the zheng qi, right? But neither of them are winning. So you get chills, and then you get this, or shivering, right? Shivering, the body's trying to create more wei qi, it's trying to move, right? And then and then the body sweats, it pushes everything out. And then it's trying to create more yang, it's shivering back and forth, trying to create this yang, and then it sweats, right? So you have this kind of stalemate, and so to speak, right? It's not really a stalemate because things are happening, but one isn't so much dominant over the other, right? So through shivering and then sweating, the goal is to generate this yang through shivering, right? To assist in warming the body. Because when you shiver, your body's trying to warm up, right? It's trying to create more yang qi, right? To push this pathogen to the wei level, try to create this yang. This yang will be an aspect of the wei qi, moves to the exterior level to help sweat things out, right? And there, when you sweat, then the body can push things out. So it's an effort to invigorate yang internally, push this pathogen up and out, and then induce sweating because it's now the wei qi is being able to open the pores and get it out and resolve it through the surface, right? Resolve it through the surface of the skin. If this happens and it happens successfully, then the fever cools down and the pulses will show recovery, right? So it can be successful in this, right? You can take the pulses and they'll show, hey, they're starting to moderate. They're starting to come down out of this. It's not so hot anymore. You don't have rapidity. You don't have these other signs of pathology in the pulse. The heat on the tongue is starting to dissipate. This is a great sign. Okay, so this thing is working. But it's not always successful, right? So if this is unsuccessful, if the body is unsuccessful in this process of rousing yang, invigorating through sweating, and then pushing this pathology out to the exterior of the body, then what happens is, if this is unsuccessful, then you'll find that you'll get a growing heat signs. These heat signs are going to increase, and you're not going to get that full sweat. You're not going to get it to go out and then resolve, right? And the pulses aren't going to normalize, and the tongue's not going to show that it's clearing heat. You're going to end up with an increased amount of vexation, irritability, and agitation, restlessness. You're going to notice the person becomes more twitchy. They want to move around. They don't want to sit still. Their legs, they might be thumping their heel, right? These type of things happen. They might be moving their legs back and forth. They don't want to sit still, or they kind of thrash in bed if they're laying in bed, right? They don't want to sit still, and they can't get comfortable. And they notice that they can't get comfortable. They keep moving, and they look irritated. And they keep sighing, almost almost like a scoffing sound, right? And they're irritated. This is a sign of vexation of the heart, right? And the pulses will race. They'll get rapid, right? So this is a sign that this, particularly, you can feel them in the Sun position and the Guan position. This idea that this stuff is moving up. This heat is moving. It's affecting the liver. It's affecting the heart. It's moving up in the body, right? It's getting more rapid, right? So this is a case where the zheng qi is too weak to eliminate the Shi Xi, right? So it's not able to do this despite its efforts to try to invigorate and create yang, right? So this heat pathology will probably then move deeper into the body. It's going to end up moving deeper, and you're going to have to treat at the next level. So if it moves deeper, moves past the Qi level, it's going to go into the Ying level, right? So, let me see. I can't see what I wrote here. So this can create severe symptoms resulting in relapses. So a lot of times what can happen is if this isn't taken care of, then what can happen is this will end up in relapses where the person ends up having, oh, come on, I'm trying to move this here. That doesn't want to move for me. Oh, there we go. The person will have relapses where they'll shiver, and then they'll sweat, and then they'll shiver, and then they'll sweat, and they'll go back and forth. But in the process, what happens with that? Every time you're sweating unproductively, you're going to end up losing yin qi. So you're going to become more yin deficient, right? And you're probably going to what? Burn through yang in the process too, so you can become qi deficient, right? By the time you get down to your yin level, you're going to be already exhibiting signs of yin deficiency if this constantly happens, right? Back and forth. And you're going to probably see exhaustion, right? So you're going to see a much weaker zhang qi in this case. All right, pain. These are all the new things we didn't really go over yesterday. All right, so pain. There could be many different types of pains during Wen Bing, right? A lot of them. Obviously, you've got an external invasion. You're going to feel body aches. You're going to feel headaches, right? But you can also feel abdominal pain from blood stasis amassing, right? You can feel chest pain if there's injury to the low vessels in the chest, right? So you can feel these things. You can get a heart attack. People can have heart attacks if there's heat that enters the pericardium and cause it to close internally, right? And then that will move into the network vessels of the chest. You can have injury in the intestines, right? And you can get pain down there. And then you can get damp heat that dries, right? And it causes bleeding in the intestines because it dries out the intestines and this cracks, right? This inflammation, and then you bleed and bleed. So you can get pain wherever this pathology moves to, right? Let's see if I can move this a little bit here. There we go. So when pathological qi enters the superficial layers, right, it can engage with the wei qi. The wei qi is normally circulating through the body, right, warming the interstitial spaces in the muscles and the sinews. But when that gets blocked, and when the free flow of yang qi is blocked, you get stagnation and pain. So you start to feel achiness, right? Just like a wind cold invasion. This is just a wind heat invasion or a damp heat invasion. You can feel this, right? You can feel that the wei qi is blocked. So you feel like you're coming down sick. You might feel like, oh, my chest, my upper back is achy. The nape of my neck is achy. I'm feeling hot. I'm starting to get a headache. The more heat it's in this, the more wind that's a part of this, the more you're going to get head pain symptoms, right? You can have body aches. Somebody could complain that they have a backache. The backache isn't necessarily a sign of, it's not necessarily a sign of like a kidney problem. It could be the sign of the taiyang, the exterior trying to react to this wind heat, right? And this wei qi being blocked through that. So they say, oh, my back hurts. While they're coming down sick, my back is achy, right? So this is this idea. Doesn't necessarily mean it's a kidney deficiency. It could be just the fact that the wei qi is just blocked and they're feeling that on the surface, right? Wind heat, right? Wind heat can affect the lungs, right? So it can affect the lungs in the wei layer, right? And so this heat will upflare, right? And create headaches with fevers and chills, right? So you can have the absence of sweat or no sweat. The wind can block the pores. In that case, what? It's going to block wei qi, right? So when you're having no sweating, right, and you have this invasion, you're probably going to feel more sore, right? But once you can get the person to sweat, the pain kind of resolves. Why? Because of the fact that you have unblocked the pores, but you've allowed the wei qi to fully and freely move through the body. So that's a reason why that helps with diminishing pain, right? So wind heat rising and affecting the eyes and nose, the throat, this and that, this will happen. So you can have sore throats, right? You can have red, itchy, painful eyes, right? So all of these things can happen, particularly when a wind heat invasion occurs in a Wen Bing condition. All right, wind heat toxins. Heat toxins in the Wei and the Qi layer, they can rise up, right? So they can rise up in the body, right? Because these are upflaring, right? They're upflaring in the body, so you can have sharp stabbing pain in the head and body aches, right? You can have a strong fever, right? You can have strong thirst. You can have manic agitation. Remember what we talked about? That like as the heart starts to get irritated with the heat, you start to act. You can have mania, right? Heat in the heart. And this agitation happens in the liver. You become restless, right? So these things that are if these things are happening together, you're getting stabbing head pain and headaches. You can have a strong fever, strong thirst, all this stuff. This is a sign of heat toxins in the Wei and the Qi layer rising upwards, right? So this is what this is a result of. And so you're going to want to help to clear both the Wei and the Qi layer, and so you clear this heat, and you're going to nourish Yin, right? So you're going to out thrust and clear this heat and nourish Yin. That's going to be your treatment principles for this. And in that case, you might have to open the chest to clear heat, right? You might have to gua sha to clear heat, right? You might have to treat the sanjiao or treat other points, large intestine 4, large intestine 11. Both large intestine 11 will treat heat in all levels of the body. Large intestine 4 treats heat in the Wei layer, right? Stomach 36 to be bled, right? I'm just reviewing these points. We're going to go over them in depth later on in this class today, so you guys will really have some like good quality stuff to work with. Bleeding, stomach 36 clears heat in the Qi layer. So these things will help to clear this heat out. So this will be effective in that. Other points that could be used if the heart is being vexed, right? CV17, right, will clear heat in the chest, open the chest and clear heat in the chest where it's affecting the heart. So these areas, these points will help to treat this. You know, the shoe points on the back, bladder 15, can clear excess in the heart, can clear excess heat. So these things can be worked. Damp heat pathogens. So in the initial stages, when you're in the beginning of a Wen Bing disease, whether you're in the Wei layer or the Qi layer or whatever, you can generally feel a heaviness in the head, and it wraps around. You have a distension in the head, kind of like it feels full, and it feels like there's a wet towel, right? You can even feel pressure behind your eyes, pushing them out, right? This is this type of discomfort that can happen from a damp heat pathogen in the initial stages of Wen Bing, right? What happens? This damp heat gets into the channels, particularly in the gallbladder channel, but in the channels of the head, and it can encumber, it can push down on the channels, and then clear yang can't rise to the head, right? So it can't clear things out and come to the orifices. So you feel like your orifices are blocked. You feel like, oh, my eyes hurt, you know, my head hurts, you know, it's just like it's swollen, it hurts. All of these things that happen are symptoms of dampness in the channels. And so damp heat coming in an initial stage, right? So you can have a dizziness, right? You can have an unsteadiness when standing, the orifices are blocked. And so, I mean, this can also be wind. This can also be a wind sensation with dizziness or unsteadiness. But if you're seeing it together with the closing or the heavy distension, this is normally a sign of clear yang, unable to rise due to dampness in the head. So you want to clear dampness in the head, right? And first you want to clear heat and clear dampness, right? Because remember, in Wen Bing, dampness is generally responding to heat. So we want to clear the heat first, and then we can resolve the dampness. Because if we try to go to resolve the dampness first, what can happen? We just create more flaring upwards fire, right? So you want to be very careful when you're treating a Wen Bing disease that you treat the heat first and always as primary, and then everything else falls in line after that. That way, you'll be much more successful in what you're doing. All right. You can also have heavy sensations, right? This is also another damp sensation. Heaviness in the trunk, heaviness in the limbs, particularly in the if it's in the trunk and not the limbs, this is dampness stagnant in the exterior muscles in the body. If you feel weak limbs that are kind of weak and painful, and they're very tired, this is a sign of dampness affecting the spleen. The spleen has a heat, is being affected by heat, and then dampness is coming as a response to that because the spleen is unable to transform its fluids. So then what happens is that dampness that occurs because it can't transform fluids, right? It can't transmutate these fluids. These fluids then come up as dampness, then come and react to the heat. And so that's where you would get, that's where you would see it in the limbs a lot of times, where that dampness is affecting and encumbering, this damp heat is encumbering the spleen. Generally, this is in the Qi level, right? So you're going to need to clear damp heat. and open the channels to the limbs to help for spleen qi and spleen yang to move out to the limbs. All right. First, what I am from teaching you guys for the last day. All right, I'm thirsty. All right, so wei level. In the wei level, thirst is generally mild. It's not going to be severe. It's not going to be something you need to drink. I just need more and I need more and I need more because you're trying to quench this fire. No, it's not that case. You don't have fire really in the wei level. It's heat, right? You won't have fire, right? That's just so it'll be mild. Even if the tongue is dry, you're not going to have, you might have thirst, but it's still going to be mild. It's not going to be very strong. In the qi level, if you're in the qi level, thirst will increase greatly because heat increases damaging fluids. Remember, in yang ming symptoms, when you have fullness in yang ming, you'll have this incredible heat and incredible thirst. Why? Because you have incredible sweating, right? So you're burning through, you're using these yin fluids, the body needs to replace them, right? Think of like a wei level issue would be more like heat in the lungs, right? Or dryness in the lungs due to wind heat, right? So that could be something that occurs maybe, for example, somebody who teaches. They're out teaching, like I have for the past day. You're talking a lot. So you're constantly losing lung yin, right? This is one of the reasons why like an apple a day is good for the teacher, is because it nourishes the yin in the lungs, right? Or a pear. So if they're teaching and they tend to be lung yin deficient, then if they get hit by an upper jiao wind heat, a wind heat that comes in the wei layer, right? They're going to have a tendency to have this, damage the fluids already. So they're going to definitely have some thirst, right? But when it gets to the qi layer, they're going to have a lot more thirst really quickly because they were already yin deficient to begin with, right? Because they are a teacher, they talk and they lose lung yin through their speech, right? This person who's in the qi layer, the one with the pathogen who's in the qi layer, you have a lot of fire, they'll want to drink more cold drinks, right? They'll want things that are cold, things with ice. They might even want ice cubes. This idea, cool down this heat, right? Anything cool, cold, a cold stream of water, this idea. They might have a desire to drink hot. If they have a desire in the qi level to drink hot drinks, you might think, well, wait, but we just said yang ming, they'll want cold drinks. But if it's in the qi level and it's not a yang ming presentation, it could be phlegm, rheum, or dampness affecting the spleen stomach, right? Which isn't a super, super hot presentation. That's more of a damp heat presentation, right? And so you're trying to move this damp heat or this phlegm that can congeal from the heat. And generally when this congeals, it congeals along the diaphragm, right? It'll congeal in and along the diaphragm in the middle jiao. So it will affect what? The spleen, the stomach, the lung, and even the kidney. Well, why do I say the lung and the kidney? So when you inhale, the diaphragm, which starts here at the middle of the body, right? And it goes down and anchors down to Mingmen, right? Or Du 4, right? So governing vessel 4. That goes down to between bladder 23 and the kidneys, and it pulls this lung qi down. The kidneys what? Pull down on this lung qi. So when phlegm sits in and around the diaphragm, it can be pulled down into the lower jiao and affect the ability to grasp, or the kidneys' ability to grasp lung qi, right? And it can cause, it can press down on the kidney yang, right? It can cause dampness to press down on kidney yang. So this is the reason why they might want to be drinking hot drinks. They're trying to increase this yang, right? To move this dampness, to try to transform this dampness, to try to strengthen spleen yang, kidney yang, and the lung yang, this lung qi, right, to diffuse outwards. This is the reason why somebody who has a qi level presentation of damp heat would be more likely to crave hot drinks. Does that make sense to people? All right, cool. All right, we're gonna keep going. All right, thirst. Thirst while having loose or often explosive diarrhea is a sign of yang ming heat. You can have constipation in yang ming heat, but you can also have diarrhea if the body's trying to clear heat out of yang ming and it hasn't completely dried the yin in the yang ming intestines, the yang ming bowels. Then you can have explosive diarrhea first. You can also have something called counterfluence, or circumfluence, which is this idea of you have a dried stool from yang ming heat, but water flows around the stool. So you have watery, almost like clear diarrhea. So you have alternating constipation, diarrhea, constipation, diarrhea. So you would have thirst in that case. This is Yangming heat. You have Yangming heat, but you have thirst because you're having this alternating constipation, diarrhea, and this fluid you're drinking, even though you have dried stool in the intestinal tract. Fluids are moving around that and coming out, trying to disperse the heat outwards. So that could be an example of that. So you need to moisten the intestines, you need to nourish fluids, and help to engender fluids for the intestines to purge heat in the intestines. So you're going to have to obviously clear heat, but then you're going to want to nourish fluids for the intestines so they can purge heat within themselves, purge heat within Yangming, right? All right. So Ying level. So if you have thirst in the Ying level, generally it's a dry mouth with no thirst, right? Generally, in this case, you can have some thirst. You're going to want to drink small sips, but a lot of times you won't have any thirst because the Ying Qi and the Yin Qi is damaged. So the spleen is so damaged it can't even do anything, right? So it can't really transform, and you don't want anything. You have to make the person drink. They need to drink in this case, because their yin qi is so deficient. It's not so much as of a full heat sign. If you have real full heat signs in the yin level, you may have more of a desire to drink. But as those full heat signs decline, the person might not have a desire to drink because you're seeing heat signs now from yin deficiency. So you want to just adjust that. Let me see here. You want to just adjust that so that you help to nourish fluids and help to clear heat and nourish yin, if that's the case, or clear replete heat, nourish yin and fluids, if that's the case. So adjust your understanding of thirst and Yangming. If they still have replete heat, you'll probably still see thirst. If it's just deficient heat, you probably won't see as much thirst, but they still have to drink warm water, right? Still have to drink fluids, warm broths, things like that. So whenever you have thirst, that's accompanied by a bitter taste in the mouth. We all know it's pretty common. That's a gallbladder channel, a foot xiaoyang issue, sign of fire in foot xiaoyang, right? This bitter taste comes up in the mouth. So that would be what? You could possibly have something stuck between the wei and the qi level. And this is coming up and you're seeing this, right? So this could be a thing. You could also have heat in the middle jiao affecting the liver, and the liver could shunt its heat to the gallbladder. And if it's shunting its heat to its external pair to try to clear things out, because the yang is what clears in this case, then you can see fire in foot xiaoyang. All right, we're going to break here, and we'll be back in 15 minutes.